Welcome back. Now, we want to look at what we refer to as the FDA pregnancy drug categories. Now, the FDA is none other than the Food and Drug Authority, which is a body that is responsible for all drugs and medications in the United States. Of course, we are covering this because it applies actually global. It's a global concept. Yeah. So when we talk about FDA pregnancy drug categories, the FDA found out that some drugs cannot be used in pregnant mothers. You know, pregnant mothers are very delicate. One, because they are carrying two lives. The life of the mother herself and the life of the baby within the mother. So there are drugs that are what we refer to as a no-go area to be used among these mothers, and that is very, very important. So as a prescriber or as someone who is learning or studying pharmacology, you need to know these pregnancy drug categories from FDA because they are global and they apply internationally. Now, these categories are divided or are categorized into four. There's what we call category A, there's what we call category B, there is category C, there is category D. Actually, there are five. 1, 2, 3, 4. And then there's a category X. Now, drugs that should be used, or the different drugs that we have on market today, or in all pharmacopoeias, they have to fall under each of these. Yeah? And we are going to see which drugs can be used in pregnancy and those drugs that are usually called no-go areas as far as pregnancy is concerned. Now, category A drugs. These drugs basically have not demonstrated any risk to the fetus. And so adequate studies in humans have been done, and the good news is that we have not seen any risks of these drugs being used in pregnancy. Now, an example would be iron and folic acid, because you will see these drugs being given as supplements to pregnant mothers. And so they do not pose any risk. Actually, mothers taking them is actually beneficial to the growing child or the growing baby in them, because it will prevent effects like neurotube defects and all that. So it is very good, or it is essential that mothers take they take iron and folic acid supplementation when they are pregnant. Now, there is another category called category B. Yeah, category B. Now, in category B, animal studies have been done. However, they have indicated no risk. But in humans, there are no adequate studies that have demonstrated whether there is or there is no risk. And so, ladies and gentlemen, we are in a nutshell saying that these drugs can be used in pregnancy, but they should be prescribed, of course, as we said earlier, by a qualified professional, someone who is qualified to prescribe. Why? Because there are no adequate studies that have been done to show that, these drugs are not risky in pregnancy. However, they are used in pregnancy if need necessitates. The other category is what we refer to as category C. Now, category C, basically, there is a potential risk when animal studies were performed. And animal studies basically indicated some adverse effects when they were being used in the animals. And however, there is no sufficient data to say that indeed it is dangerous among the humans. And so these drugs can be used for their potential benefits. That is, their potential benefits may necessarily outweigh their potential risks. And we shall see examples as we move. So these drugs are referred to as category C. Now, we also have another category referred to as category D. Now, in category D, there is evidence. Remember, in category C, there is no adequate evidence. But in category D, there is actually evidence of fetal human risk. In other words, when these drugs are given, there is some evidence of risk to the fetus. However, ladies and gentlemen, their potential benefits to the mother might warrant their use. In other words, we are saying that if the mother has this particular condition that necessitates them to take a category D drug, and the physician or the prescriber deems it necessary, then they will give this medication. The other category of drugs that is a no-go area to all pregnant mothers is what we refer to as category X. Just like you see that, just like you see that symbol X, yeah? It should not be used at all in pregnancy. And so, ladies and gentlemen, studies in animals or humans have shown adverse effects of these drugs. And evidence of observed fetal abnormalities have been seen when you use these drugs. And so their risk in pregnancy clearly outweighs their use. In other words, we are saying that we do not or we cannot use them in pregnancy because their risk outweighs their benefit once they are used in pregnancy. A very common example that you will find are anti-cancer drugs. A very common example that you'll find are anti-cancer drugs. And one of them that is very, very important is a drug called thalidomide. Now, I've stressed that drug called thalidomide as you will see a documentary on the same. Now, this drug was used mostly in Europe in the mid 20th century. That is about 1960, 1970s, usually in the mid 20th century. And it was being given to pregnant mothers for treatment of what we refer to as morning sickness. However, no further studies had not been done to see how disastrous this drug is. And so this British company, Diageo, basically manufactured it and sold it to mothers or pregnant mothers for treatment of what we call morning sickness. And the products that came out, or the children that were born, had disastrous abnormality gross effects. You would find those without no hands and those without no feet. Or others were born blind. So those are the disastrous fetal abnormalities that we are talking about. So you will watch this documentary and you will see how disastrous and how heavily this company had to pay to compensate all the people who were actually given this medication. So thalidomide is an example of a category X drug. Not only thalidomide, but most anti-cancer drugs. So examples of these drugs, as we shall see, and as you can see, drugs like antiemetics, Drugs like analgesics and antipyretics basically fall under category B and C. Drugs like acetaminophen, this is paracetamol, falls under category B. And antibiotics B, C, and even D. So the list is endless. And however, you may not know, because we have so many drugs on market, you may not know which category it falls. But it is worth reading about that drug before you either take it if you're pregnant, or before you prescribe it if you are an authorized prescriber. And so we have other drugs, antimalarials, and as you can see, the list is endless. And so those are some of the common prescribed drugs and their categories. You can read about more, because every drug has a pregnancy drug category attached to it by FDA. So, ladies and gentlemen, that has basically been it concerning FDA drug categories used in pregnancy. And we said there are basically 5 categories. We have category A, where we said that these are safe to be used in pregnancy because their studies have demonstrated no fetal risk to humans. Then we have category B. These are drugs that have basically, they are also used in pregnancy, and studies have shown no adverse effects on the animal in animal studies, but however, there is no adequate or enough information in the humans to render them not to be used. And so they are used for their potential advantages or therapeutic effects to the mother. We have category C, and in category C, we see that we have seen some adverse effects on the animals or in animal studies. However, there is no adequate data or information concerning humans. And so they can be used for their potential benefit by the mother. And in category D, we have seen that indeed there is evidence of fetal risk. However, for their advantage, they can be used. Not sometimes, of course, they cannot start from first trimester. They may not necessarily start using them from first trimester, but maybe second and third. And so, in category C, we saw that they can be used for their potential benefit to the mother. And lastly, we looked at category C, which is a no-go area to all pregnant mothers. Why? Because their benefits, their risks or the harm that they bring about outweighs their benefit. And we gave an example of thalidomide, of which you will watch that documentary and you'll see how disastrous it was and how heavily that British company Diageo had to compensate these patients. Now, you will have to do a test in this, and when we come back, we shall look at the routes of drug administration.